So, hello everyone, welcome to our webinar today. I hope everyone's managing to stay well, and thanks for joining us. We're getting more and more people joining, but we'll kick off because I know that everybody's really busy. So I'm Sally Williams, and I look after the Helpforce network. With me today is managing the team side of it, and will be on hand to make sure the session runs smoothly. So thank you, CJ. We're recording the session, by the way, just so that everybody's aware of that, and we'll be sharing the recording as soon as we can after today's session. So as you know, our theme for today is resilience, and how you can ensure that you and your team are as prepared as you can be for what's likely to be an even more challenging winter than usual. We're thrilled to be joined today by Dr. Laura Porro. Laura's going to be talking to us about how we respond to change and added pressures that we all experience from time to time, particularly at the moment, and how we can build in resilience to the cases. So just to tell you a bit about Laura, Laura's a principal consultant at PPL. PPL, in case you haven't come across them before, they are a social enterprise, and they exist to promote better health, well-being and economic outcomes across the UK. So they do that by working with communities and all of the organisations that support them. Laura's going to be doing a presentation. She's got some slides which she's kindly agreed to share after the session today, and to answer any questions that people may have. She's going to be using some interactive tools during the presentation to help her participate fully and get the most from today's session. And then we'll have time for Q&A afterwards. We'll get through as many as we can before 12:45, because that's when the session's due to finish. So if you could use the chat box or the raise your hand function on the toolbar in the middle of your screen, we'll get round to as many of those as we can before the end of the session. And to let you know that in the audience today, we've got Jane Fox from NHS England. Jane has kindly agreed to take part in the discussion. And as you may know, Jane has been closely involved with the NHS England recovery framework, which will have direct relevance for those of you who are working with volunteers in the NHS. So without more ado, hi Jane. Jane's bottom right of my screen. I don't know where she is on everybody else's screen, but thank you for joining us. So without more ado, I'll hand over to Dr. Laura Porro to kick off with the session today. Hi, Laura. I think you're on mute, Laura.
Yes. Hi all. Thank you, Sally, for the introduction. Some of you might remember me from the previous webinar that we did a couple of months ago. PPL has been supporting Helpforce for over a year now. We've been working closely together. And PPL works exclusively in the public sector. So as Sally said, we are a social enterprise. We specialize in health and social care, and we work with NHS organizations, third sector organizations, and local authorities. We are a small team. There's about 23 of us. And you will find my contact details on the slides that I will share at the end, but I will also pop my email in the chat, and feel free to reach out, give me a buzz anytime. What Sally said is right. We're going to cover quite a few bits around how to manage ourselves and others in these very challenging times. And we're just going to scrape the surface, really. So if you have any questions or curiosities or want to hear more about any of the things that I'm going to talk about, feel free to reach out. I'm going to use a tool called Mentimeter. You might not have heard of it. That's totally okay. You might have heard of Slido. Basically, what I'm going to ask you to do is to open a new tab in your browser or a new window in your browser. You're going to put in an address and a little code, and then it's going to be pretty obvious what you need to do at that point. If you're using a computer, you just use your mouse to open a new tab. If you're on a tablet, the same. You're going to need to use the app for your browser. If you've dialed in with a phone, if you still have access to a computer, you can do it. If you're just on a phone because you're on the move or driving, then don't worry, because I will talk through what's coming out of that activity. So so don't worry about that. If still that doesn't work for you for whatever technological reason, there is still the chat in the Teams window. So one way or another, we will be able to hear from you. So I'm going to start by sharing my screen. And hopefully you can see the screen. The first question is a really difficult question. How do you feel about heading into the autumn? So please go to the website indicated above that slide. So www.menti.com and type in the code 7461910. And you will be able to see that question and you will be able to insert words. And what you will see on the Teams screen is that everybody's input will come through. And we will generate a word cloud, and then we'll be able to take a screenshot of that word cloud and then send it back to you. And what I'm envisaging is that there will be quite a spectrum of emotions, because some things about this winter look really scary, some things look more positive. So we will see what people say. I can already see we've got 7 people have managed to come into the Menti. If you have any tech issues, let us know in the chat. Great, 15 people coming in, great. So the big word in the middle is apprehensive at the moment. There's also some positive ones. I have an excited, a hopeful, uncertain has now taken over. I'm going to give us another minute or two to put in your words, so keep typing in. And we're creating a beautiful word cloud. We now have 30 people typing in. Uncertain is now the biggest.
Yeah.
We've got uncertain, apprehensive, and anxious. Some more positives are also coming through. There's a curious. There is an excited, a hopeful. Hopeful is also quite big. And that's a really important one, actually. Great. Let's see, I see still few people logging in and typing their words. So I'm going to give another minute to this. And I think that what I'm seeing so far is that the breadth of emotions really reflects what you guys have, what we've all gone through in the last 6 months. And this is affecting how we feel going into the next 6 months. I can see that the pace has now dialed down of new words coming in. So if you move to your Teams screen, you will be able to see the word cloud that we've generated. And really, there is uncertainty. That is the key word of this time. We don't know what's going to happen. This is the first winter with COVID-19. Not only is COVID-19 a really tricky and dangerous disease, but also some of the symptoms are really similar to flu, which complicates things. We do not know whether the cold weather is going to have an impact on the severity of the virus. We do not know whether we will need to go into another national lockdown. Uncertainty is the key characteristic of times of change. And boy, have we changed literally everything. Since March, nothing is the same to what it used to be. And we're going to come back to this because change is tricky, and being able to understand it a little bit more will help us manage it. So thank you very much for sharing your feelings. And I want you to stay on the Mentimeter a little bit longer because I have another question for you. Given these feelings, you know, the uncertainty, the fact that you're anxious and apprehensive, you don't quite know what's in it for us for the next 6 months. But looking back at the road you've covered so far in your services, in your teams, what was helpful? What did you do? What did your colleagues do? What did the service do that actually helped? So something that was positive in the last 6 months, whether it's an aspect of service delivery or whether it's something that happened in your teams or in yourself. So if you are still on the Menti and use the same code, tell me something that was actually helpful and that helped you cope in the last 6 months. Okay, so I'm already seeing a thread coming here, something around people working together. So it seems that despite the chaos, the tragedy, the uncertainty, the confusion, there's something I'm seeing here around the relationship between people, and that has helped. I can see teamwork, communication, peer support, adaptability, working in partnership, group of volunteers, fantastic group of volunteers. That's super. That already is a hint as to what helped in the last 6 months, and perhaps it's a hint as to what might help in the next 6 months. We need to draw on what we have seen work. You need to draw on what you have seen work well in your teams, in your services, to manage the next bit. I can also see another theme coming strongly around technology and in general tools. So the fact that we have been able to move online. Many people have said, imagine this pandemic before the internet. What would have life looked like in a world without internet? Our experience of the pandemic would have been very different. But now we've had the ability of move some activities online. Let's see if any other themes are coming through. Collaboration, common vision. I like that. Common vision, priorities, shared ambitions. I think we really gelled around the fact that there was this huge thing and we had to do it, and we had to do it now. There was no option. So that also helped really focus people's minds. Great. So thank you very much for sharing all these. And I can see these themes coming through. And again, do keep these in mind. What I'm going to do now is I'm going to shift to share the slides. And therefore, you can be on your Teams screen again. And I'm going to share a little bit about change. So we're going to think about change and then think a little bit about some practical suggestions, hopefully tools that you can take away. So when you think about change, there are some dynamics of what happens inside people when they're going through change. From the very small one, your bus changes its route and you have to take a different road to work, all the way up to there is a pandemic and everything in your life has to change. So every time you go through change to a smaller or greater degree, you will experience perhaps all of these things. Feeling awkward, feeling that things aren't smooth, thinking about what you've lost, the fact that it was so convenient before, why do I have to do things different now? This difference is usually in the first instance worse. I mean, I'll admit, I cried when I heard the news that we had to stay home, because it was, I only thought about what I had to give up. I'm sure I'm not the only one to have been really upset by that message. Not just because of what prompted that message, but because I thought, what I'm going to lose by not being able to do the things that I was able to do before. Feeling lonely. And yes, in the pandemic, of course, we felt lonely because we were physically apart. But sometimes, even knowing that everybody else was going through exactly the same, it's difficult to it's difficult to feel helped by that because you still feel so alone. Number 4 is really important. The fact that we had to keep changing, and we can only manage so much. The first few weeks were in a way, then we could start doing some things, and then we could do even more, but then we had to go back. And now there's a new rule of 6, and then there's the mask. Can we have it indoors? Can we have it outdoors? Do we have to have it indoors? It just keeps going on, and it's difficult to keep track. You sometimes don't feel like implementing that change. You know, somebody tells you, you now have to do this thing, and you just don't want to. You're like, but actually, I'm not ready to change that. And also number 7, well, we're seeing it in the pandemic at a immense scale, but of course, if you don't keep reminding people to wash their hands, to keep their masks on, what do? They do what they used to do before. They have huge gatherings. They forget to wear the mask. They don't use the hand gel. So we're seeing this in the small scale, in the large scale. And even think about it, you know, last time you changed the configuration of your living room and moved the sofa from one wall to the other, you probably have felt some or all of these aspects. And this might seem obvious, but actually being aware of these key dynamics of change helps us, especially when we're dealing with colleagues. Perhaps you're line managing someone and you see them they're distressed and you're not quite able to spot what it is. Perhaps thinking about which of these dynamics are going through. Is it that they're not ready? Is it that they've been asked to change something every week for the last 6 months and they just can't take it anymore? So sometimes naming, is this what the problem is? Is this what you're going through right now? Can help you understand what others are going through. So it's a really useful tool for your self-reflection, but also to diagnose why you're seeing issues in your teams or in your services. The next one is one that you perhaps have seen before, but people have different appetites for change. Some like it more than others. You probably have a friend who's always, you know, after the latest phone, the latest tech gimmick, and they're just in the line to get the new phone the night it is released. And some people will never even update their apps on their phone. Some people really love change. They really love changing their hairstyle, their clothes, and others never do. Again, there's nothing good or bad. There's no judgment value associated with this. What we have is just different approaches to change, and it's really important to be aware of that. So are the people around you, the people you work with, what is their attitude to change? So champions are usually not that many. In a team, you might have 5% of your people might be champions, and they are usually excited, and they will be enthusiastic, and they will want to be at the forefront of that change. And that enthusiasm can be overwhelming, but it doesn't necessarily reflect what everyone else is feeling. Chasers are about 15% of the people around you, and they might not immediately accept your proposal for change or a proposal that might have come from someone else. They might wait and see who is signed up for it, who's not signed up for it. They will want to discuss the idea before deciding what to do, but eventually they will sign up to the change. And they could be really good allies, because they can actually ask you really good questions and ensure that change is going in the right direction. Converts are likely to be the majority of the people around you, so 30%, 30 to 40%. They will listen, they might not ask many questions. They will want really solid evidence to understand why now they need to do something differently. And they will need to be reassured about the impact. It's really important to work with this group, because they are the majority of the people around you. So if you can bring them on board, you know, by talking to them, by showing them why it is a good idea, then you will have a large proportion of your team on board. Challengers and change-phobics are about 20% of your people, and they will be tough. You know, they will ask lots of questions. They might even try to stop you. So it's important to understand who they are and why they are reacting like that. So do not avoid speaking to them because you're worried to be challenged, but speak to them and try to understand their point of view. Why are they so opposed to that change? They might have very valid reasons why they don't want to change. And especially in the current circumstances, we have this problem with the pandemic where largely we're out of control. If we have to do something, we got to do it, and we haven't got much choice. But that doesn't mean that all of a sudden everybody will be up for that change. So we still need to be able to work together, even though we can't choose, and even though that change might really feel unpalatable to some. All in all, basically during change, you are subject to a number of triggers, because when you are changing, some of the things that are changing are, for instance, the people. During the last 6 months, I'm sure that you've worked with people you'd never worked before. Some of these people were lovely and fantastic to work with, and some of these people got on your nerves, no end, I'm sure. Culture, you've worked probably with organizations that you didn't work with before. Again, some might have been a really positive experience of meeting an open culture, and others might have been not so much. Well, tasks, systems, and processes, I don't even need to give examples of how those can get on our nerves and really annoy us. And also, especially in this context, there's a lot of change. 1 week we have this system to follow. Next week there will be another system, another process to follow. The list of tasks seems to never end. So it's helpful, again, when you're working, you know, with your self-reflection, or when you're working with others, to understand what the issue is. If something is going wrong, is it because of culture? Is it because of people? Is it because of tasks? Or is it because of systems and processes? And once you've identified what the issue is, then there is a little tool we can use to see what we can do about it. And these are the 4 A's: avoid, alter, adapt, and accept. So let's start with accept, because, no, actually, let's start with avoid. So there will be small things that annoy you or give you problems that you can avoid. Okay. So for instance, I have a leak in my ceiling. I've got literally water pouring down behind me. I can decide to stress about it and be really worried about it, but actually this is not gonna stop the leak. It's not gonna speed up the resolution. I call the plumber is gonna come. I choose not to stress about it. I've called someone who is an expert, somebody who can do something about it. So I am not going to spend the day staring at the ceiling, looking at the wet patch and, getting bigger. It doesn't help. So I can make that choice and just avoid that stressor. I know that sometimes it's really hard, but try to see which things you can genuinely avoid and say, actually, I can let this one go. Sometimes you can alter the stress or alter the situation. So let's say you have a colleague and you find it difficult to work with this person and you can't avoid them, right? You have to work with them, but there's something about the way they work that is creating an issue. So try to alter the situation, giving feedback, organizing a meeting with that person and saying, look, I can see, you're doing these things that are having this impact on me. Is there anything we can do to change? And we can talk about feedback techniques, perhaps not today, but that's something that we can go back to give feedback in a way that is that diffuses any potential conflict. Adapt. Now it's coming more towards you. So in alter, you're trying to change the external issue. In adapt, you're trying to get around it in your head. So you can try to reframe, for instance, an issue more positively. So that's what we all did up to a point when we were told to stay home. We couldn't avoid it. We had to stay home. We couldn't alter it. We couldn't ask Boris to let us go out twice a day instead of once a day. We had to adapt and reframe it. So I told you before, I cried when I heard I couldn't go out. And then after a couple of days, I thought, well, actually, there's things I can do to make this more palatable, to make this not just about what I've lost, but to think about the things I've gained, the time I've gained, the money I'm saving on the commute. And then after a bit, it was fine. So you can reframe things in your head, but one key thing to remember about adapting is that it doesn't happen instantaneously. So especially if you're helping someone else adapt to a stressor, you got to give them time. And then the last one, accept. Again, we've all become masters of this during the pandemic. There are some things we can change and we can control them. And those things we just have to live with. However, if we have worked on all the stressors we have in our lives, all our triggers, and we have done a good dose of avoid, a good dose of alter, and a good dose of adapt, then hopefully the things we have to accept are a little bit fewer. And that helps because the things we have to accept are the toughest ones. But if we have managed to manage the others with avoid, alter, and adapt, then overall we're probably better off. I'm going to stop talking now because I want to go back to the beautiful things you shared at the beginning of the session. And I want us to think a little bit more about the next 6 months. And you've told me how you're feeling now, and you've told me what helped. And what I heard was that you, the things that helped were around people working together. So what I want you to do, and I'm going to share now again, is to go back to the Mentimeter. The code is different. So www.menti.com, and the code is 4974823. And I want you to think about what those relationships looked like. So you told me collaboration was good, teamwork was good, we had peer support. So what was that healthy relationship, that healthy dialogue with people? What did it look like? What does it feel like? What does it sound like? So I want you to tell me, what is that collaboration? What does it look like in your experience when it works? So go to Menti and let's share our thoughts. Okay, so supportive is the biggest word at the moment. So there's something around people helping each other. There is a theme there, respectful, non-judgmental, and understanding. I love those. Kind, the kindness, that's becoming very big in our cloud. Yeah, I'm loving what you're writing here. Respectful is very big. Positive, open. Yes, so this is wonderful. I know more are coming. We've got almost 30 people logged in, and the biggest ones are collaborative, supportive, and kind. That's fantastic. And this, if you think about it, really resonates with the things we've said. You know, if you think about the dynamics of change that we talked about, people feeling focused on what they've lost, people feeling worried, people only being able to manage so much. And these things that you are just putting here in this workout, it address exactly that. So you're saying what you need to do is to support each other, to collaborate, to be kind, to understand. And this really resonates also with the 4 A's, that little tool I gave you. you can help others identify what they can let go of, but also understand that there are some things that they have to just put up with. And this is a lovely, lovely word cloud, really. I also like the listening bit, because it goes, you know, all of this you can do if you've really listened to the other person, if you've given them a chance to speak, and you've really taken the opportunity to hear what they have to say, because only through that are you then able to support them and tell them and give them something useful. This is great. And I'd like, if you stay there on the Mentimeter, to move on to the next one, which is thinking about the next 6 months. You've shared at the beginning, you know, that sensation that you have of it's mostly uncertain, anxious. But given what you said about what worked in the last 6 months and what enabled that, which is the one we just did, what do you think you can do to promote collaboration going forward in the next 6 months, which you said is going to be key because it worked in the last 6 months, so hopefully we'll continue to support over the next 6 months. Great. So I can see a lot of ideas coming through. I like there's a theme here already. Share success stories and positivity. I love this. Be a positive role model. How do you counteract the anxiety, the uncertainty, the worry, the negativity, which we all inevitably feel, and it's very much justified by the fact that the situation is truly dramatic. But you can still say some things are working. We are still achieving some good results. And why is this important? Because sharing the success stories, showing some positivity, this will help you bring the converts on board. Remember, in our little spectrum of change reactions, you want to work on the chasers and the converts, and you want to bring them on board by telling them why it is good. You're not going to convince them by harping on the negativity of the current situation. You're going to convince them by showing them a better future. In context, of course, this is still going to be a tough winter, but there will be some positives. The word communication is popping in right, left, and center. Be supportive, reach out strongly, clearly, and frequently. Really important, and that's coming out. Many of you have written, reaching out. Keep talking. Keep that channel open. This is wonderful. And I want to pause there because I'm really conscious of time. And I think also this is a really good time to actually open up the floor to some conversations, because I think this has given us a lot of really tangible ideas that we can take forward over the next 6 months. I will, of course, collate these and send them at the end, but I'm going to stop sharing now and open the floor. Thank you.
Laura, thank you so much for your really helpful, insightful presentation. I don't know if there's anybody who would like to be first to make a comment or ask a question. You can use the chat box, or you can put your hand up using the toolbar on your screen. And then Jane, did you want to come in there with any comment or anything you'd like to add into the conversation? Sorry to put you on the spot.
No, it's fine. It's fine. So I think that's been really helpful. Thank you. It's kind of thinking about where we are now and what we've been through and where we're going next. For me, I think that it's important that we all, I suppose, give ourselves a break on this. It's been a tough 6 months, and it's going to continue to be tough as we go forwards. So I think for me, this moment to stop and just think about actually some of the good things, some of the positives, is a really important point, a really sort of good breathing space to actually take stock and think about how do we regroup, how do we prepare ourselves for what's coming next. I think from my perspective, from an NHS perspective, I think we've all got to be really mindful that there's a lot going on at the moment. The NHS is facing really, really huge challenges, and we are all part of those, the solutions and the response to some of those challenges. And if we think about the context that we're in, we are obviously, as Laura mentioned, you know, we are still in the midst of a global pandemic. COVID is still here. It hasn't gone away despite opening up the economy and schools. The pandemic is still here and is still, you know, the virus is still out there and very prevalent. So we are going forward in that context that COVID is happening. And of course, that brings the implications that as the numbers rise, the pressure on services potentially increases. We're also in a place where we're still going through a phase of recovery. So services that sort of had to stop or were stepped down somewhat because of the COVID pandemic and the sort of the furore that caused, have been brought back on stream, are still coming back on stream, and there is an expectation that they will continue into the future, that we won't necessarily step them down or stop them again. There is an expectation of them continuing to be delivered alongside that emergency response. And I'm going to say those dreadful words, winter pressures. We know every year that winter brings additional pressures on services and on staff. And if we could really do without it at any time, you know, now's the time when that pressure on staff is going to be even greater. And not just on staff, on volunteers that are part of the response to this as well. And so I think we really have to give ourselves a break, think about some of the positives that we've achieved, some of the huge achievements, you know, stepping down entire services or stepping them back up, refocusing volunteer roles into new roles, you know, maintaining that communication and support mechanism for our volunteers who may be isolated or desperate to come back, but, you know, we've had to protect them. There are some real positives in there about where we've come from. And I think what we need to do is, I suppose, I'm going to use an expression, gird our loins for going forwards, because there will be other challenges, I'm sure, that will face us all. And, you know, the organisations that we're part of. And it's really, I think, about us being ready for that onslaught and looking at, you know, where is our support? Where is the support that volunteer managers need, or that we as people need? And again, I'm going to sing the praises of Helpforce, just the opportunity to come together, talk to like-minded people, share that concerns and worries and some of the solutions and some of the answers. I think is going to be really important over the coming months. So can't sort of advocate enough how important it is to reach out and talk to others. Sorry, you're on mute, Sally.
Thank you. If I had £1 for every time somebody said that to me. Thanks, Jane. We haven't so far had any hands up, but Laura has kindly offered to share her contact details on the slides and in the chat box. So if anybody does come up with a question or a thought following today's session, Laura is there to have a chat with you. So thank you, Laura, for that. Jane, I know that there's been some positive reaction to the NHS England recovery framework, hasn't there? Have you had much feedback from volunteer managers around the country?
I think we've had some feedback that it's been really welcome. I think when we first sort of were faced with how do we help, what could we offer, it's really difficult because many of the organisations were in very different places, and we couldn't give a hard and fast answer because a lot of this is down to local determination. And I think from our perspective, what we wanted to do was provide a framework that would help everyone wherever they were in their process of recovering services or maintaining services, or still having to work with services that were stood down. So we tried to address all eventualities within that. what it might be helpful for me to do is to talk a little bit about where our thinking is at now in terms of going forward. So some of the support that people will need over the coming months is thinking about, you know, precisely those three things I mentioned, which is, you know, the ongoing COVID situation, the fact that we are still running services through recovery and in parallel to any emergency responses, and winter pressures. So we are looking at how we can support systems through the winter pressures in terms of what volunteering might look like or feel like going forwards. Again, that's got to be in the context of COVID. We are looking at updating. So you'll recall we developed some COVID specific roles last year that were COVID contextualized, given where everyone was. And I think what we want to do is probably revisit those and update those for where we are now, given that, you know, the circumstances have changed, but we will also have some opportunities to think about other new roles. So, you know, these extra pressures that have come on services. So I'm thinking about things like test and trace and, you know, the whole thing about flu vaccinations. What, you know, how are they going to impact on services in addition to all the other asks that are happening? Of course, the Nhs Volunteer Responders is continuing through winter as a service that is available for people to refer into and access. So again, it's a resource, it's there. If any of those roles or services or needs are useful, refer into it, use it while it's there. We don't know what the future will be for that scheme, but it's there for now, and it's there and it's intended to help people. So if there are things that those volunteer responders could do to help your organisation and your sort of patients and communities, think about those as an option. And the other one that I think sort of comes up is there's a whole tranche of work that's happening now around what we're calling beneficial changes. So I think it's the good stuff that's come out of COVID, and it's been a horrible disease, a horrible virus. It's had huge impact, huge implications. It's still affecting so many of us, but behind the scenes, we all know that some huge strides have been made. You know, 3 and 4 year programs have happened in a matter of 6 months in some ways. Things have had to happen overnight. We've just thrown bureaucracy out the window in some cases and made these things happen. So what we want to try and do is lock in those beneficial changes. So looking at things like, you know, the recruitment and the onboarding, how can that be supported and maintained so that it doesn't revert back to normal, which is, you know, one of Laura's warnings is the minute you sort of say it's all right now, everybody's behaviour reverts. What we want to say is try not to revert to old behaviours. Let's try and lock in and sort of move forward and build on some of the positives. You know, the flexibility around roles and volunteers. I know it's unlikely that we'll return to everything back as normal over the, you know, for the foreseeable future. But what's emerged are some really innovative ways of engaging volunteers in different roles, enabling people, for example, to do roles virtually, which has enabled them to be involved and included, you know, and potentially opens up opportunities for others. So locking in some of this. Technology is a huge one that has just changed everybody's lives, and I think there are some positives from that, but there are also some challenges. I don't know about you, but I get sort of Teams fatigue just going from one.
Jane, you've gone on mute, I think.
Oh, that's weird. There's somebody trying to shut me up. And passporting, that's the other one. The other thing we're thinking about is passporting still exists as an option, that license to attend, so that people can move between NHS organisations. That's still in place to March, and obviously that's something we're looking at going forwards. So there's a range of things we're trying to do and look at. But what we don't want to do is engulf and swamp anybody with asks. So really mindful of that, and we will try to minimise what we ask of people. So I'll stop there and open up because there's see some hands up. Thank you.
That's brilliant. Just a comment from Elizabeth at Plymouth, who says that she's used the framework as a main tool when addressing the recovery of volunteer services and found it really helpful. So that's really great feedback. Thank you, Elizabeth.
Yeah.
And Debbie from South Tees, you had your hand up. Did you want to say something?
Yeah, just kind of on the back of the information that Laura shared, which is great. We are now in the fortunate position that we've almost flipped back to where we were in terms of bringing back our existing volunteer group. All of our COVID volunteers have now gone back into what is their new normal life. But we've had to obviously look at things differently in terms of the roles that people can't come back to. So we've, which I'm happy to share, we've devised some roles around community discharge packages for patients going home, and that's done not in the hospital site but in another part of the hospital where there's no contact with the ward referring for patients that will require essentials, toiletries, things going home, and that's going to be run solely by volunteers. So we're looking at different roles that we can put them into because they can't come back into the clinical areas. And one of the other things that we've just devised is a resilience buddy programme. I've been very lucky to get funding to bring a registered mental health nurse into our team, and they're going to assist with building this programme. So the substantive team I've got of employed support workers will form a buddying service for the volunteers. So, you know, if they've got any issues, and we're going to do that online, they can just message straight through to say they've got a query, they need support, and just to offer them some of that reassurance. So I'm really excited about that, because having the mental health nurse in our team and an acute trust is going to be a great change for us. But the fact that they want to be so heavily involved with supporting the volunteers is fantastic.
Somebody's just popped in the message in, and I think it's one is if you could share those roles, because I think they sound like really interesting roles, and resilience is certainly one. If anybody else has got any examples of that kind of supporting and resilience type role, that would be really useful to think about sharing, because we're all going to need some strong resilience going forwards. I can guarantee it.
So, Sally, is it easiest for me to just send those through to Helpforce, and can you pass them on?
Yes, please. That would be great. We'll circulate them with the recording. Thank you. And Mandy from Sussex Community, you had your hand up.
Yes, hi Sally and all. Hi Jane. I just wanted to reiterate, you know, yes, how useful the NHS framework was, and it was great because it was recognised at, you know, at senior level, and you know, I was asked by my chief nurse to complete it, and even just that in itself, you know, was helpful. You know, it's just to raise that profile, and I think also we mustn't, you know, have we really sort of discussed about, you know, I know that Mark Lever from Helpforce in the Health Service Journal, you know, highlighted the fact that volunteer workforces have been decimated. Our executive boards, you know, totally aware of what's happening. You know, mine are only just getting that knowledge really through from me, really, because we're looking at an 80% loss of our volunteer workforce. So I'm just wondering what other trusts, you know, are you know, they all sort of similar. And I think, you know, Jane, Emma spoke about some NHSE funding. I'm not sure what was happening on that front. Would be good to know, because I'm trying to put a case together for our recovery, you know, to get back to what we were, to deliver on all our various strategies as an organisation. So that would be helpful to know. Just very quickly, obviously, the push on getting volunteers trained to the volunteer certificate through Health Education England, obviously mentioned in the NHS People Plan. So that's an extra bit of work that I've got to do. And again, I'll see what other trusts are doing. I'm really positive about it. I think there's some really great modules there, and so that's really positive, but again, it's just more work. The passport thing, I'm not getting on very well with the volunteer passport, because I haven't really had much need for it, and I'm just interested to know where was the identified need to put that in place. I haven't really heard much about that, you know, so that volunteers could be portable. So that would be good just to find out a bit. And also, I was told by Emma just to look on, it would be good so I could feed back to our execs just responses from the NHS responders, because she'd requested some more volunteers, and I said, oh, everyone's going to be desperate for volunteers, but of course we will share that with our volunteer workforce, albeit a very small volunteer workforce currently. But that's all I wanted to say. So thank you. Nice to see everybody. Yeah.
So if I come back, because I've got, I think there's 3 points picked up in there. So funding in terms of funding from the centre. We are looking at how we can support trusts with winter pressures. You'll recall we had a winter pressures programme last year, which was about putting some funding out to enable people to kind of work to support winter pressures where they were needed using volunteers. The ambition is to do something similar this year, but we haven't got any details yet, because we're having to bid for funding and make sure that that funding is in place if indeed we can get any funding, given all the other pressures on systems. But it's certainly an ambition to be able to try and support the winter pressures through volunteering and make sure that that money is available if we can. In terms of the passport, the portability, I think I'm not sure there was necessarily an identified need and everybody was clamouring for this. I think what we've done is we're aware that passporting is a challenge, and moving volunteers between different organisations puts that pressure on in terms of onboarding, checking and redoing training, etc. So I think what we did was jumped on the opportunity that COVID presented to put the portability option in place. It means it's an option, it means it's there if people need it. One of the things I'm starting to think about with passporting is, rather than it being a passport and if you've done this training you can move anywhere, I'm starting to wonder if it's more of an immunisation record. So it's a list of what you've done, and if you've done it you don't need to have it again, but you will need boosters and you will need to fill in any gaps. So I'm thinking about it in a slightly different way, and that's just the way my brain is working at the moment. I like to tag it on to a concept. And then volunteer responders, I've just forgotten what the question was. No, I've forgotten what your question was, Mandy. I do apologise.
No, don't worry, Jane. It would be good to look at the data, and Emma's just showed me the link on NHS Future Platforms. I've got to do that because I think our trust would be interested, because especially there's quite a need to recruit more in our area down in Sussex. So I've just got to do that bit of work.
So just to give a bit of context for that, so on the volunteer responders, there is going to be some very local recruitment going on, and that's particularly to meet the demand where there remains a demand and capacity has slowed down. And we've noticed that some of the capacity slowed down as people have gone back to work, for example. So there will be some, encouraging people who have switched off or gone back to work to see if they want to switch back on, but also some additional opportunities for recruitment for volunteer responders. But that's very, very local. It's not national. It's only where it's needed. So
it's so funny because you're still getting anecdotal information. You meet people and they go, oh well, I registered for that, never been asked, never been, you're still going to get that. It's strange, isn't it?
Yeah, one of the challenges I think is that when you put out a national call, lots of people step forward. So the capacity didn't reflect where necessarily the demand was. So that's reflective of just happenstance. And what we're trying to do is make sure that now any attempts to recruit, we are more targeted, and it is based on demand and need. And I want to just reassure people, this is not about taking volunteers from somewhere else. A lot of volunteers will volunteer in different ways and for different organisations. And I think what we're very mindful of is this is not about, stealing volunteers that might be used somewhere else. It's a different type of volunteering. It's micro volunteering. It's one-off task type volunteering, which they can do around existing volunteering commitments if if people are worried about that. And I don't want people to sort of think we're trying to, you know, steal all the volunteers in the world for volunteer responders. It's just there is a need. There are people out there that need support and help, and their needs aren't being necessarily met by existing infrastructure. So it's another way of just propping that up and helping through this difficult period.
Thank you, Jane.
Thank
I'm
you.
conscious we've run over, but it's such a good discussion. Lynn, you've put your hand up. Would you like to come in there? You're on mute, Lynn. Lynn, you're on mute.
I think that's the most used phrase.
Yes.
I'm Lynn Witham from Epsom and St Helier NHS Trust.
Hi.
The manager for the trust. Just quickly on the passporting thing, I had a Teams meeting Tuesday with somebody from Royal Surrey County Hospital, and on board with that was another 16 people, some of which were from Surrey and Sussex Healthcare NHS Trust. And it was all the voluntary services. Also, there's a few hospitals there, but mainly the volunteering in community and volunteer centres. And it's because they have so many of the volunteer responders who they think are going to be out of work, but they're not working, obviously, by the end of the year. And there's so many of them, they're trying to passport them into our environments, other environments. They've got so many people, they're trying to move them. And with an acute trust, we do have problems with policies and procedures. We have to follow them, and people have to have DBSs done by us. They have to be trained by us. It's not so easy to passport within an acute trust.
No.
But certainly in the community, there are lots of people. So if you come from that, if you come from an environment where you really need more volunteers, then I would suggest you get in contact with these people. And Helpforce are on that. We had who was the man? Darren Wright was on that Teams meeting, and it was Sian Salis from Royal Surrey who had coordinated the whole thing. So I don't know if that's helpful to any of you.
Thank you, Lynn.
Yeah,
brilliant. Thank you. Yeah, those names are we know. Darren works with us, and Sian is a member of one of the systems members of the network. So no, that's really good to make those links.
All right. So I'm really sorry, but I'm going to have to love you and leave you now.
I'm sorry we've overrun, but it's been such an important and interesting conversation. So thank you all for joining us. Thank you particularly to Laura, Dr. Laura Porro, for your excellent presentation and for making us feel very hopeful and as if we can have some real influence over the circumstances. So thank you very much. It's been really, really great session. And as you know, we run our virtual check-ins twice every fortnight. So look out for emails letting you know when the next one's going to be. If you fancy a chat or just to share ideas and strategies with colleagues, please do join us. So thank you again, and hope to see you soon. And thank you, Jane.
No, thank you. Thanks, everyone. Bye-bye.
Bye for now. Bye.